All right, everyone, we'll go ahead and get started. So welcome to our 2025 Cold Stone Therapy as part of the Q3 rollout. We are excited to bring the new service for you this promotion. So we'll go ahead and get started. My computer wants to work with me here. The agenda that we have for the call is we're going to review these benefits, the contraindications, identify the difference between the hot and the cold stone services and what that does for the body, the treatment room, the service itself, and then again, we'll end with any questions that you guys have about the rollout, or if you've already started the training, what's come up from your therapist in the training. So as a review from the rollout guide, the benefits, some really great things with cold therapy, right? We know that cold therapy is kind of a big buzz right now with a lot of different services. And doing stone is nothing new for massage therapists. It's been around for a while and can do some really great things when we think of inflammation and swelling. So when we introduce that cold, it's going to create the vasoconstriction to slow down that circulation into an area that's inflamed. So this can be really great for whether somebody's had a flare-up of a condition or just struggles with those ongoing types of swelling conditions that are out there. Another great thing to consider for our guest is the benefit about easing tension, headaches, and migraines. So, what we know about cold therapy is that we will see the uh, the nerve endings slowing that transmission of pain signals to the brain. So, this is going to help slow that progression, or really help calm the conditions of what causing those headaches, especially with migraines, because migraine is going to be a vasoconstriction component. Tension headaches, when it's in its high tension and it's swollen, that's when the cold's going to be really beneficial. The activation of the parasympathetic nervous system. So when we have the cold and we use those slow rhythmic massage strokes, this is going to encourage the body to go into that rest and digest response. And so this is where the body can reset itself a little bit during this massage. And it aids in pain management. So again, reducing those muscle spasms, the pain sensation. So it can help from anything from an injury, somebody actually injured themselves, or those onsets from post-workout that the body perceives sometimes as an injury when people are working out. Now, what we're doing with this service is we're pairing it with our Relief Sports Balm. So we know that that cooling gel that eases pains and aches because of the ingredients of the menthol, peppermint, and the wintergreen. When we introduce this with the cold, whether it's doing balm first and then doing the cold stone, or ending after cold therapy, this can be some really great pairing. So when we think of headaches, going back again, relieving, bringing that relief when they use together that coal and this gel. If you're pairing it with an inflamed joint, this can bring the instant relief, but also longer lasting results than maybe one used alone. And then when we include the balm on an injured area to reduce that inflammation and the pain. So again, I go back to post workouts. This can be really helpful for those guests that you guys have that are kind of, whether they're a weekend warrior and they kind of play hard on the body for activities or sports, or it's someone who consistently is tearing down their body through workouts. This can really help with that onset of the soreness with those workouts. Now let's talk about some guest scenarios that we would see. So as your therapist are going through the training and they're getting ready to introduce this to the guest, what are the guests that they work on currently that they can find would be really beneficial? The post-workout, the muscle soreness, somebody who's looking to recover from anything that they've been going through. So very commonly we see a lot of that, like that upper body, the shoulders, the upper back from maybe overlifting, overdoing something. If you get some ball players that are doing maybe that repetitive throwing, these areas will be very beneficial to this therapy. Then we think of like the lower extremity, your quads, hamstrings, calves. These a lot of times get overused in some activities. If you have some runners, people who do maybe a lot of lifting on the lower end, doing hiking, these can be a great benefit for those folks. Next, we'll talk about joint issues. So there's quite a few conditions that people may suffer from when it comes to swelling or inflammatory, but we also think of that repetitive strain injury. There's a lot of different work, uh, uh, people that do different things. When we computer, a lot of typing, so maybe wrist and elbows. This is a repetitive strain injury somebody might suffer from. We can think of some of our construction workers, whether they're working overhead or they're maybe using like hammering, building. When we think of the people who do something over and over again, they're going to really benefit. And a lot of times we see those joints kind of take the beating from that repetitive strain injury. So some common areas that you're going to see that guests are complaining of that we may want to target, those knees, elbows, shoulders, wrists. Or the condition of plantar fasciitis. We know that people suffer from this. So this would be a great protocol to get that cold stone and be able to use the stone to help really open up the bottom of the foot. That cold is going to really alleviate a lot of that swelling. So we can think about the joint issues with your guests that can be beneficial for the service. And then again, mentioning that headache and migraine. This is a great way for people, especially who have chronicity with their tension headaches or migraines. This can be a great way without using drugs, non-invasive. We can introduce this service to really help alleviate some of that tension. Sometimes people with those migraines, they know that they're coming, like the onset. This would be the ideal time because that's where we're going to have the most benefit. Generally, when people who suffer from those migraines, especially those that might last like that 48 hours, 72 hours, that later stage, they're probably not going to want a lot of work done, but some may, and that is going to be that cooling sensation will help calm some of that pain they're having. The neurological calming factor that we're going to see with using cold is what really is going to be that winning component to this injury. Okay, so our contraindications, as was outlined in the training guide, of course, pregnancy is our number one. So we're not going to do this with any pregnant guests, even maybe be mindful if they're lactating and nursing. Our cardiovascular diseases. So the most common one, the disorders we're going to want to be mindful of is high blood pressure. Again, is this under control? There's a lot of people who have high blood pressure and they're completely fine. But if they have a little bit of out of control, if they tend to see their doctor a little regularly regarding their blood pressure, this isn't going to be a good service for them. Blood clotting disorders as well, if they're taking those medications, blood thinning, this is going to be a very cautionary type of guest that you're going to want to consider doing. Deep vein thrombosis, DVT, is not going to be recommended. We're going to want to avoid altogether. When we think of diabetes, we're really thinking about those that are dealing with the peripheral neuropathy. That's going to be the biggest concern because they're not going to be able to communicate that sensation. Again, if their diabetes is under control and they're living a normal life, then, this is not going to be as concerning. We want to consider the skin and irritation. So various different things like rashes, burns. I mean, we are in summertime, so people are spending more time outside. While sometimes it might seem that a cold stone on a sunburn might feel good, it may not be the best time to do this service. Of course, any cuts, any open wounds, any sensitized or damaged skin is not going to be recommended for this service. All right, so our hot stone versus cold stone. So this is maybe a new concept for some of your therapists. We are all very familiar with doing the hot stone. It is a very popular service, our most popular service in the system. And both of these therapies have great therapeutic benefits and are beneficial for our guests. So let's identify the biggest differences that we want to make sure our therapists are mindful of when working with these stones. So we know with hot stone, the introduction to the body is going to require that heat transfer. We are avoiding burning our guests, so we want to make sure that we're having that caution. We introduce the heat a little slow, and making sure the body's acclimated to prevent burning. The speed of the strokes when we're using hot stones are going to be a little bit quicker in the beginning as we're introducing that heat. And then later, we get those more slower, rhythmic, therapeutic strokes after the body is acclimated. The stone isn't as hot as when we first introduced it. The function of hot stones, right? We're pushing heat into the body. The body's already pretty warm. So now we're adding more heat that we're pushing inward. So our biggest caution when we use hot stone is that we don't overheat the tissue in the body. Now, if we look at the cold stone, this is where things become very different. The introduction to the body is very direct, that cold straight to the body, and we're going to have that static stone placement. The body's natural reaction to the cold is going to be to pull away because we are drawing heat away. So that holding of the stone is going to be important as the body acclimates to that. And our speed of the strokes is going to remain slow throughout the massage. So it is slow and compressive type of techniques as we are using this. Generally, we're going to use the stone in shorter parts of the body in the beginning, and then we'll move into more longer connective strokes with it. So those are the biggest things of the difference. Now, once the body's acclimated to the coolness, we can then start working with the stone as a tool same way we do with the hot stone. Are we getting in a little bit of deep pressure? Are we doing some cross fiber? All of that's still going to be applicable to both of the temperatures with the stone once the body's acclimated to that temperature. So this is a great chart for the major comparison, and I included this into the training guide. So the temperature, we can see the biggest difference. Ideally, we want that temperature with the cold stone between 40 to 45 degrees, whereas we're around the 120 degrees with the hot stone. The effect on the vessels, right? One's going to constrict and narrow, while the other one is going to open up and dilate. Which affects our blood flow differences. The primary purpose, right? So a lot of our cold is going to be that inflammatory and calming our nervous system, whereas on the hot, we know is going to be more relaxation, helping muscles relax, reducing some stress. Although some people might find cool is stress reducing, so that one can kind of dance to both. Emotional benefits. So, right, again, sometimes this can be subjective to the person, but traditionally we're going to see more of that refreshing, rejuvenating, getting more energetic. So this might find, which is great for summer months, right? The heat sometimes makes us a little sluggish if you're in the hot states like Texas. This creates a little bit of energetic rejuvenation. I'm going to feel a little more energized when I get off of a session, whereas more relaxation and grounding on that hot stone. When we think of the best for more of that inflammatory, the initial injury or inflammatory responses, whereas on the hot stone, that chronicity, chronic tension, high stress is going to be a calling for that hot stone. The therapeutic use we've outlined, right? Really good pain management, reducing swelling on the cold, and then resetting the body and some stress reduction on the heat. Okay, so we know sensation, cool, brisk, awakening, whereas comforting and warming on our hot stone. So this can be a great chart for your therapist when we're talking, even the LCs, when we're thinking of what's going to be best. Do we stay with the hot stone for a guest because their body needs that? Just because it's a promotion, we don't want to promote a cold stone if they're not a good candidate for it. So this can be a helpful way to decide, which is maybe asking the questions and seeing where our guest is at. And remember, guests can change day to day, right? Stress levels can change. Inflammatory responses can be a factor depending on what we've done in our life and our daily routines. Okay, so let's talk a little bit about the service. So the outline of the service details is 6 stones for each service. Now, I would recommend getting different size of stones for this service. Getting a bowl, in the guide, we recommended the retreats get a bowl if you don't already have some, very easy to get, and fill with ice that's going to fit the 6 stones. Getting those stones cooled about 15 minutes prior to the service is going to be ideal. That's going to really help get that temperature of those stones to about that 40 to 45. Stones will cool faster than they heat up. So that's one of the benefits here is we can, when we start, if you have a 9 a.m. cold stone service, you can get those stones on ice, finish setting up and getting ready for the first massage, and have your stones ready to go for that massage. So that's one of the benefits to this service. You're going to want to make sure that there's a small towel out with the bowl. We have our Relief Sports Balm handy and of course, the Pure lotion that we're going to use in the massage. There is a consent form that comes with this, so we're going to make sure that that consent form is signed before doing the service. So some, things to point out as we're getting ready for applying the stones is as we remove that stone from the bowl, we want to make sure we dry it. We don't want to have drippy cold water kind of going down your guest's side, making them feel cold. We only want that coldness coming from the stone directly. So wipe down that stone and work with your guest's breath. Again, remember that cold naturally people are going to react to pull away. So we want to work with their breath. So having your guests take a nice deep breath in, and on the exhale, we're going to go ahead and apply that stone. And we're going to keep that compression for anywhere from 30 to 60 seconds, just holding it in place. Check in with your guest. How are you doing? Okay, things are good. And then we can begin going into some gliding. Gliding in small sections in the beginning. And as you glide, you can turn that stone. Glide, turn the stone. That coolness will continue to be felt with the tissue. Now, some tips to remember when we're working with the body and these cold stones is the body, the superficial nerve structures of the lower back and the medial side of our limbs are going to be much more sensitive than the upper back or the lateral side. So if you're on the back, you're going to start upper before you go to the lower because the body's been acclimated to that temperature. If you're on an arm or a leg, you're going to want to start on the outside before you introduce it to the inside. Letting the body get acclimated in that area to the temperature is going to keep the guest experience well, but also going to not give such a shock and awe. So each bowl of stones are going to be cleaned per service. So there's no cross-contamination. So what makes this great is that as you use an area, a stone in an area, you can throw it back in that ice. It can cool so you can use it in another area. 6 stones should be great, but as you're working, you may find that you're going to reuse those stones, and that's completely fine. We're going to take that bowl and all those stones at the end of the service, all take them back into the team retreat, wash them, antibacterial soap, and they'll be ready for the next service. When we're using the Relief Sports Balms with the stone, so when you use them together, there's 2 ways. You can either do the massage with the cold stone and apply the balm and then move on to another area. If you apply the balm while you're still using the cold stones, it's going to have a stronger effect. So you're just going to want to be mindful of sensitivity with your guest. Some people are going to love it. It's going to be great. And maybe if there is a kind of a highly inflamed area or a lot of soreness and the guest can handle it, that would be ideal. You're going to want to know your guest and check in with that feedback if that intensity is good for that guest. Um, and so just keeping that in mind as how you use that balm with the stones. And then we want to be mindful that we're only using it on two areas. We don't want to do this throughout the whole body because that's going to get very intense quickly. So what are the two big areas that are bothering the guest? Is it the knee and they're having a headache? Great. Use it on the knee, use it on the headache. That would be a good two areas. It's not going to be too overwhelming for the body itself. Okay. And with the resources, so we do have training videos, went through and, showed the hands-on of using the stones, did an introductory clip. So they are about 5 different individual clips that we did with the videos. So we have them uploaded in SharePoint that your RD or franchisee can either download to a computer or in the team retreat, you can access it. And so it is under the communications folder, the calls and rollouts guides 2025 Q3. Remember, this is only a promotional service, so it is not going to go into Woven. Now, depending on how this service goes and the feedback that we get, maybe down the road it can turn into something more. But until it is a branded service that is on our menu permanently, we won't put it into Woven in the training side. So for now, it's going to live in SharePoint. And this is how you're going to be able to access those training videos for your therapist. If you hire any new therapists during this promotional time, they will be able to view those videos there. And I was going through as an ABMP member. If you are a ABMP member, there is a free 1-hour CE course on cold stone therapy. It's a great hands-on course. I believe it was done about a year and a half ago from a therapist, and really talks about a lot of things that we shared here in ours. But you can just see and listen to him perform that. What I really like about this video, just as a side note, is he really talks about body mechanics in this video. So it could be a good video for therapists who might just struggle in general with with stone therapy, how they hold the stone, how they work with the stone. Because sometimes we know that you can grip it too hard or you're putting too much tension that's not needed, and they might not even be aware of it. So this can just be a nice refresher. Depending on your state, this could actually be a CE course that they can apply for their state licensing, not in the state of Texas, but everywhere else very well is a possibility that this can be used towards your CE hours. But it does, I went through the course, printed out my certificate just so that you have it. It's a great complement to to your certificate courses. So that is an additional resource for all ABMP members. I did go on to AMTA and I did not see any Cold Stone services with that CE group. So that's why I would mention the ABMP. All right.